Well, if you have served our country and you're on TRICARE because your husbands were 20-year veterans of our country, that is a healthcare system that you have earned the right to have, that TRICARE system, which does have some co-payments and deductibles. I fought to make sure that that system was going to be preserved for military retirees. And I also fought to make sure that if a military retiree had a disability as a result of his or her service for our country, that they'd be able to collect both their retirement pay, which they've obviously earned, and their disability. Somebody in that circumstance was the only federal employees not to be able to get both retirement and disability pay. It was called concurrent receipts. And when I was a freshman in 2003, there were a bunch of us that threatened to vote against the budget, which is the one area that you have maximum leverage, unless it was my leadership. So the Republican leadership acquiesced and allowed people that had that disability to get both their disability pay. And it was a tremendous accomplishment. And certainly one of the things that, I was just part of a group that made it happen. But when I look back on the years that I served, I think that was one of the greatest accomplishments that we had in Congress.
Yeah, because he's a veteran from Vietnam, so, it's...
Well, and I think most Americans, if not all Americans, would agree that those people that have worn the uniform of our country deserve a healthcare system that meets their needs. Now, not everybody, you have to be a 20-year veteran to qualify for TRICARE, but the veterans healthcare system should be open to veterans, and I fought as a member of the Budget Committee to add over $1 billion a year for the 5-year window of the budget to the veterans healthcare system. My amendments did that in 2005 and 2006.